Apex location with Skorpion Dental Optima. The film is made under the methodological guidance of Professor Boris Injov, Doctor of Dental Science, Director of Conservative Dentistry Department at Faculty of Dentistry, Sofia. It is a well-known fact that endodontic treatment success depends on the proper preliminary processing and obturation of root canals. The good result from the treatment is at risk in case of preparation or obturation above or below the physiological foramen, foramen physiologicum. X-ray testing is a common method of determining root canal's length for work. Apart from determining the length for work, it gives information about the endodontic cavity location, about canal curves degree and direction, about not found root canals, etc. Unfortunately, the X-ray determination of canal length has the following disadvantages. Radiation of the tissues in case of a frequent X-raying. Certain inaccuracy caused by the character of the X-ray image, which is a two-dimension image of a three-dimension object. Electronic apex locators are devices of great significance for determination of length for work. They can be used either independently or in addition to the X-ray methods. In this film, we will discuss the method for work of electronic apex location and the symbols and signals character produced by the Skorpion set. It is a well-known fact that tooth tissues possess different electrical resistance measured according to buccal mucous membrane. Tooth enamel has a high resistance range of 1 to 10 megaohms. Dentin containing odontoblasts and dentinal liquid has a resistance range of hundreds kiloohms. Physiological narrowness area has a relatively low constant resistance range of some kiloohms. The resistance is about 20 kiloohms 2 mm away from apical foramen and 10 kiloohms 1 mm away from apical foramen. Periapical area and periodontium have lower resistance and are close to that of the gingival tissues. The given resistance is approximate and depends on the tooth pulp and periodontium condition, on the extent of drying, on treatment medicines, etc. In 1962, Sunada found out that the resistance between buccal mucous membrane and apical periodontium is 6 kiloohms. That grade lies in the basis of electronics. In order not to make dentists remember these numbers, in Skorpion set the measuring process can be seen on the screen and a voice defines the area where the instrument is. To illustrate the measuring process, one has to imagine an ideal root canal with an almost round cross-section, without any sharp curves, lateral canals or delta branches, and with a well-shaped apical narrowness. Choose a canal widener of a big size, number 15 for example. Canal widener has to be with a plastic handle in order not to cause a short circuit if accidental touching of mucous membrane and other tissues occurs. Put a rubber stop on the canal widener 2-3 mm from its top. Mark a point where we will set the rubber stop and which will be further used as a starting point to determine the distance to the physiological narrowness, foramen physiologicum. Put a passive electrode on buccal mucous membrane. Measuring the length for work starts with the entering in root canal orificium. Gradual canal widener introduction follows. The introduction is slow with an easy forward movement. If the canal widener touches the enamel, the device doesn't register any grades because of the enamel high resistance. If the canal widener touches the dentin at the beginning of a root canal, the device registers resistance, which gradually decreases with penetrating in deep and reaching the physiological narrowness, foramen physiologicum. An approximate assessment of the instrument penetration degree has been done on the basis of preliminary research. In Scorpion set, top canal widener penetration in the canal, comparatively far from the apical narrowness, is indicated by an oral message dentin, and a canal widener gradually penetrating in a tooth can be seen on the screen. Measuring accuracy improves considerably when canal widener approaches foramen physiologicum. Reaching a preliminary defined statistical grade of resistance, an oral message 2 mm to the foramen physiologicum will be heard, and a scaled diagram of penetrated to 2 mm canal widener top can be seen on the screen. Resistance continues to decrease in case of further instrument penetration in the canal. Measuring accuracy improves. Reaching a resistance characteristic for about 1 mm distances, a 1 mm instrument penetration can be seen on the screen, and the message 1 will be heard. In slow penetration of canal widener top to foramen physiologicum, the device registers the characteristic resistance of 6 kΩ. A diagram of instrument penetration in the foramen physiologicum appears on the screen, and dentist hears the oral message, foramen physiologicum. Dentist takes out canal widener and, using endodontic ruler, measures the distance between the canal widener top and rubber top. Then dentist prepares the processing instruments. Canal widener continues its penetration. Its top goes into periapical area and touches the soft periodontal low-resistance structures. Penetration in the periapical area appears on the screen, and dentist hears an oral message, foramen anatomicum. In such a case, dentist has to take out canal widener to 1–2 mm, move the rubber stop towards the instrument top till it touches the reference point, and then he repeats the measuring. Some mistakes can be made in the electrometric determination of the length for work. A. Determining the canal longer than it is. It might happen in cases when tissue resistance has been increased additionally. The extra increase of tissue resistance is a result of overdrying root canal or its treatment with high-resistance medicines, and rarely in cases of periapical changes caused by the accumulation of high-resistance organic substance. B. Determining the canal shorter than it is. It happens in cases of the so-called wet canals. They have lower resistance, which is the reason why devices register earlier penetration in 1 mm or 2 mm areas, as well as earlier and fake registering of the physiological narrowness. This effect can be avoided to some extent if canal is dried by a paper slip or drain on a Miller-type needle. If canal wetting is connected with rich exudant secretion or bleeding, device most frequently misses some of the messages, for example, dentin 2, 1, and directly announces foramen anatomicum, or gives jumbled messages in a different combination. C. Case in which apex locators give jumbled information. Penetration in the canals of the most common teeth types is accompanied by oral messages in such sequence: dentin 2, 1, foramen physiologicum, foramen anatomicum. If during penetration canal widener top touches low resistance structures, oral jumbled messages in different combinations might appear in the sequence. If the lateral canal is wide, these jumbled messages might appear in such sequence: dentin 1, 2, 1, foramen physiologicum. Canal perforation. dentin, foramen anatomicum, 2, 1, foramen physiologicum, etc. To obtain an accurate measuring and result interpretation, the following two important rules should be observed. 1. Exact results are received if X-ray testing information and electric resistance measuring information are combined. It is of great importance in determination length for work of the multi-root teeth canals. 2. When carrying out Apek's location, we should pay attention to the sequence of the oral and screen messages. If the sequence of these messages is different from the correct one, it means the instrument top has touched tissues with different from the statistical ideal tooth resistance. Apek's location is a comparatively accurate and convenient method if the measuring results are interpreted correctly. The method is very reliable and no other option has been found so far.